This segment of the Safe Injection Practices Review addresses the many activities involved in preparing a vaccine for administration. Before you even begin to work with medication, including vaccines, make sure the environment in which you are working is clean, free of distractions, and has work surfaces that have been properly disinfected. Then you can clean your hands and move on to working with the medication you will be administering. Once you are certain which vaccine or vaccines you will be administering, then you can begin to prepare them. Pre-filled syringes have a tip on the end of the vaccine that needs to be removed in preparation for attaching the correct sized needle for the injection. A critical issue to remember is that the tip of the syringe and the open end of the needle constitute the no-touch zones. Those must remain sterile, and the needle must be attached to the end of the syringe in a way that keeps those zones sterile. Attach the needle as soon as the protective tip is removed from the end of the syringe. Syringes contain a single dose of vaccine, and most do not contain any preservative when they are pre-filled. Remember that preservatives are added to vaccines to prevent microbial growth. Vaccines that do not have preservatives do not have that protection, so they should be administered as soon as the syringe is activated. Activation means that the syringe tip has been removed and a needle attached. Again, once activated, the syringe should be used as quickly as possible. An activated syringe should be labeled to make sure there is no confusion regarding its contents and when it was activated. Selection of the needle length should be based upon where the vaccine is to be administered and the size of the patient. Vaccine administered intramuscularly should have a needle length of at least 1 inch, with many patients requiring a needle that is 1.5 inches in length. Typically, the needle size that is used is either a 23 or 25 gauge. Subcutaneous vaccines are administered into the tissue in the outer area of the upper arm, and a 5/8 inch needle length, 25 gauge, is used. If medication is drawn from a vial, the rubber diaphragm should always be disinfected prior to needle entry into the vial. Air does not need to be injected into the vial. Withdraw the exact dose that is to be administered. Make sure you know your equipment and have practiced how to attach needles to syringes in a way that prevent touching the connecting or no-touch ends, as well as the needle tip that will be used for injection. Multi-dose vials should be labeled with the date it was first entered. Make sure to read the prescribing information in case the vial must be discarded before the manufacturer's expiration date once it's been accessed. For example, Tubersol, the tuberculin used for TB skin testing, has a note in the prescribing information indicating that once opened, the vial and the remaining tuberculin should be discarded after 30 days. If your vaccine requires use of a diluent, for example, MMR and varicella vaccines, use the diluent provided by the vaccine company and not a substitute. Remember that diluents for live virus vaccines do not have a preservative, as a preservative could kill the vaccine, rendering it ineffective. If you dilute the vaccine, make sure you understand the dosing. For example, the dose of the vaccine is in the powder you will be diluting. Whatever amount you inject in the vial to reconstitute the vaccine powder results in the total dose to be administered. For example, if you reconstitute the MMR vaccine powder with 0.5 ml of diluent, the resultant vaccine volume will be approximately 0.5 mL, and that's what you administer. If you reconstitute with 0.6 mL of diluent, the resultant vaccine may be approximately 0.6 mL, and that is what you administer. Therefore, whatever amount is in the vial, once it has been reconstituted with the diluent, is the dose you administer. When drawing from a single-dose vial, you may find that there is a small amount of vaccine left in the vial after drawing up the dose. Never save those incremental doses and try to pool them together from other vials. This may result in some portion of the vaccine being contaminated and thereby compromising the entire dose. Never save any leftover vaccine doses and try to combine into another dose. Pooling is never acceptable and is a safety risk for your patient. Now, there are many questions about changing needles and whether or not the needle becomes dull when you use it to go through a vial you are reconstituting, then drawing it out of the vial for administration. Should needles be changed? Well, current needle technology is designed to accommodate going through the rubber diaphragm of the diluent vial, then into the powder vial, and still being sharp enough to use for administration. Changing needles provides a step where inadvertent contamination could occur. So if your technique involves changing needles, recognize that risk and be particularly attentive to technique. So, let's talk about our take-home points. First, begin with an environment that is clean and free of distractions, and your work surfaces must be disinfected with an EPA-registered hospital-grade disinfectant. Disinfect your hands prior to handling the vaccine or injection supplies. Verify the dose you will be administering and clarify any questions by reviewing the prescribing information and your local policies and procedures. Make sure you are not touching any sterile connection areas, such as the connection area between the end of a pre-filled or empty sterile syringe and the needle you are attaching. Disinfect the diaphragm of the vial with a sterile alcohol swab. Do this even if you are removing the plastic protective cap from the diaphragm and about to enter the vial for the first time. If you are reconstituting a powder vaccine with a diluent, such as MMR and varicella vaccines, double check to make sure you are using the correct diluent and are administering the entire vaccine dose. Avoid unnecessary manipulation of prepared doses and use them promptly once prepared. Label all vaccines you have prepared to ensure proper documentation and avoidance of administration error. Never leave leftover doses, save them, or pool into another vaccine that you administer to a patient. Thanks for your attention during this segment of Safe Injection Practices. I hope that you'll take the time to look at the next segment.